Couples spend years naturally trying to conceive and get pregnant. When they finally give up, they choose medical treatment not realizing how expensive and painful it is. Medical treatments, whether it's in vitro or in utero, require hormone therapy that creates pain, discomfort, bloating, irritation, insomnia, and even irritability that no one tells you about. Then there's the cost that reaches into the tens of thousands of dollars between doctor's visits, medications, support medications that you need to minimize the symptoms of your pregnancy medication, and even the costs of missing work. Couples that have gone through it will tell you that there's an even greater challenge that no one tells them about. There's the agony of expectation and disappointment. You start out hopeful the first time you get a treatment for pregnancy. Then, after all that pain and cost, when you expect to become pregnant, you get disappointed over and over. That disappointment is painful enough, but you add on top of that the sheer stress of knowing that you have to go through that treatment all over again. That's the treatment that creates pain, discomfort, bloating, irritation, insomnia, and even irritability that no one tells you about. Underneath all of this is the existential realization that you might have missed out on yet another opportunity in life. You are aging. The psychological pressure of that nagging little voice in the back of your head, telling you that life has once again passed you by, is a crushing heavy weight. These conditions make any hopeful mother dread their ovulation cycles. Every month becomes a dreadful event instead of a hopeful one. But this destructive cycle is easily broken. Instead of trying to get pregnant every single month and being disappointed every single month, all you have to do is wait until the month when you are the most fertile. This is going to be a foreign concept to most people, so you probably misunderstood what I just said. All you have to do is wait for the month that you are the most fertile, not the day. Women are so conditioned to wait for the day that they are the most fertile out of a month that they think every single ovulation is just as healthy and vital as the last one. So they try to get pregnant, and they even get medical treatment to try and get inseminated during a weak ovulation month without even realizing it. Yes, you are the most fertile on specific days of every month. But you are also the most fertile on specific months out of every 19.7 months. So just about every year and a half, you are going to have 2 months of extreme fertility, even if you are in your 30s and 40s. Instead of disappointing yourself month after month after month, just wait until those 2 months to try to get pregnant. You probably still haven't wrapped your mind around the concept that one ovulation cycle is going to be far more fertile and potent than another one. But think about it. Do athletes have the same performance every single month, month to month? Do runners clock the same time every single month? Do swimmers clock the same time every single month? If you ask professional athletes, they will tell you that they know what month they're going to perform best. Think about the opposite of ovulation. Think about your menstruation. Is your menstrual flow and pain and duration exactly the same every month? Some months are painless. Other months are extremely painful. Some months have very little menstrual bleeding. Other months produce so much menstrual bleeding that you actually crave foods high in iron. You know that your menstrual cycle differs every month. So now you know that your ovulation cycle differs every month. Find out when you're going to have your strongest, most vital and most fertile ovulation cycle at timeportal.pro/baby.